Now we'll talk about another artery, which is known as a transverse cervical artery. Now the transverse cervical artery is also known as a cervicodorsal artery. Okay, but usually in pictures you see it being written as what? Transverse cervical artery. If you look at these two, it's transverse cervical artery. But just know that another name of it is known as what? The cervicodorsal artery. So it's a branch of the thyrocervical trunk. It crosses the base of the neck. It supplies muscles like the trapezius, sternocleidomastoid. Okay, also contribute to scapular anastomoses. Okay, so what's the source? Arises from the thyrocervical trunk. So the main trunk is the thyrocervical trunk. So transverse cervical artery is arising from it. So it's one of the four main branches of the thyrocervical trunk. The other ones are the suprascapular branch, inferior thyroid branch, and the ascending cervical arteries. So course, it passes laterally across the base of the neck, running transversely, lies beneath the inferior belly of the omohyoid muscle as it travels towards the scapular region. Terminates by dividing into the superficial and the deep branches. Okay, so it gives a superficial branch, gives a deep branch. Supply muscles like the trapezius, the sternocleidomastoid, the rhomboid muscles, and also the scapular region. Also communicates with a lot of arteries, okay, just to make sure that blood supply around the scapula is intact. So we'll study about its anatomy because it is surgically relevant, it's variable, and it actually forms a rich blood supply around the scapular region.